COVID-19, and of course we are likely to see an increase before we flatten that curve. Just a reminder, you're welcome to let us know what your thoughts are, and that's available via social media. We also have the phone lines open to get your comments or suggestions or questions, if you like, in regards to what do you think the government should do to contain the increase of COVID-19 infections in slum area. With me in studio, we have Alex Manyasi, who has experience in particularly dealing with slum areas. Alex, I'm sure you're not, first of all, surprised by the fact that we have now a three-digit number, 123, although, like I mentioned earlier, to put it into context, we also have increased the number of tests that are done within 24 hours, but we are still likely to see that increase, particularly if we look at the slum areas. First of all, maybe your thoughts on whether these numbers surprised you or not.
Not at all. In fact, the surprise is that they're very low. That's a surprise, because we have not done the mass testings to a level where we unearth all the cases that are out there.
Right.
Because I believe that there are more cases. If you can go to one slum and test one day, and you come up with such numbers, then that confirms to you that the numbers out there are much larger than we know. And so the increase in the testing is supposed to be indicative of how much of a problem we have, and not necessarily as a surprise in terms of looking at whether the numbers are low or not. Because if we have the accurate numbers, then it's easier for planning purposes. It's possible to think about what are the intervention measures, other than being out there. People are walking around with COVID, and you're not even sure how many there are. So it's critical that we know how many people are out there and are infected.
Okay, the Ministry of Health has been very consistent in giving us numbers and keeping us updated, which has been a good job so far. But do you think that's enough, particularly in helping Kenyans understand what the effects are likely to be should we not adhere to the advice given by the Ministry of Health?
Unfortunately, the Kenyans are also caught between a hard place and a rock.
A rock and a hard place.
And I say that because yes, you know that there's danger out there. You might know that you have seen in the news what is going on globally. Some may be doubting whether the cases are there locally. But at the same time, I think it's important to realize that this is a problem that you're going to deal with for quite some time. And I think I can bet with Kenyans, unless we get a cure for COVID or an immunization is possible, then we're going to have COVID as part of us for a long time. And because of that, then it's about time to start thinking about how to live with it. And the how to live with it is about what are the measures that need to be put in place to ensure that, number one, Kenyans are safe, but they can also go about their business. But beyond that, that the people that we need to be protecting more are the people that we're putting emphasis on. So the more we understand the complexity and the magnitude of the problem, the more, as a country, we can put in place measures to actually deal with the challenges that we need to be dealing with.
Right, you've talked about being between a rock and a hard place, and of course, in the slum areas, that just becomes that much more complex. For example, wearing a mask is something that has been advised world over as a preventative measure to ensure that one stays COVID-19 free. But the cost of a mask is something that we cannot, underestimate. There are those who may not afford, so they're choosing between a mask and a meal. They're choosing between, washing your hands with soap or just letting it be. These are realities that we must deal with. How do we overcome that? Because even as we try to flatten the curve, we're likely to end up where we are now, or if not worse, if we do not take these measures seriously.
I can bet with Kenyans that the numbers will go up. That's for sure.
That's for sure.
Especially in the informal settlements, the numbers are going to go up. However, if you look at the person who lives in the slum, for example, the number one thing they think about is food. The number two thing they think about is rent. The number three thing they think about, which they're not thinking about right now, is school fees. And so anytime you think about food, about rent, about paying school fees for your children, if you're the person staying in the slums, the threat of COVID in terms of priorities in your mind does not come in the top three. basically because there are other things you're thinking about which are pressing you more than the COVID pandemic. And that is the sad reality. And so to ensure that we are mitigating against having negative effects of COVID because people are reckless, is to ensure that these three things can actually be catered for. And how to ensure that that is done is to make sure that either people are going back to work or you're giving them food and ensuring that they have something to pay rent. So if those two are not put in place, then it is going to be very difficult and challenging to deal with a person whose priority is not thinking about COVID, but thinking about how to survive survive to the next day. So I think in terms of strategy, the government has to, and have been in these informal settlements many times. I have worked with people in the informal settlements for a long time. And one of the experiences that I have had, like I've said, is the priorities that people put on what we call premiums to them is completely different. While you're thinking about how to ensure that you get to work through ensure mobility for you, and therefore a car is an essential, to someone else, they will go to work by walking to work. Because to them, the money that they have had, they have calculated and looked at it and said, if I can pay, I can buy food and pay rent and take my children to school, then I am sorted. The other things are secondary. And I'm saying my children to school because 90% of the kids in the informal settlements do not go to public schools. Because those public schools, number one, don't exist. Number two, they're not convenient. And so the parents in the informal settlement will think about a child going to a school that is next door. And therefore, by extension, the amount of money they pay, the little amount of money they pay is enough to get their child to be dropped in school as early as possible and come back home as late as possible and still be able to pick a child, which is an arrangement that is different from a public school. And so the complexities of a person in the informal settlement are such that we need to have a different package altogether, and the thinking should be and must include ensuring that the things that preoccupy their minds are actually on top of the agenda.
On top of the agenda. All right. We've concentrated a lot on what is happening right now, what are the challenges in the slum areas, but we also need to project and look at the effects that we are likely to see post-COVID-19, because we have some people who possibly have lost their employment. There are others, like we mentioned earlier, who hospital right now is a no-go zone for them. And as a result, we may be accumulating health issues that could have been dealt with earlier, but now may be left too late. What are some of those effects that you see post-COVID, and particularly in high-density areas?
So there are several things that we are going to see post-COVID, and especially, like you're saying, in high-density areas. Number one is that the reason why people live in slums is because of what I call the push factors. So the push factors are, what are these things that push someone to go into the slum? Number one is because that is where you can afford to live. Number two, it's because it's closest as possible to your workplace, and therefore you can save on that fare and walk to work. And having said those two things, post-COVID, we're going to see a scenario where for those people who are walking to work and that work that they were walking to no longer exists, then these people are going to be hanging around and having nothing to do. And so what we are going to see is that we could see a spike in issues of insecurity. So our government needs to be thinking hard about how to deal with that, because that is going to increase. Because number one, people have nothing to do. Number two, people lost a livelihood. And therefore, the same informal settlements also harbor people who are more likely to get involved into crime, because the environment is conducive for you to learn how to get into crime. Secondly, you're going to see a spike in the issues of sicknesses. The diseases that we have been dealing with, things that we had thought that we had done away with, are things that are going to be re-emerging. And so we will see a spike in the infections because people have not been going to be tested and people have not been accessing medical care. However, having said that also, you see that these people will not be affording basic amenities like water, sanitation. Because they will not afford those things, we are also going to see a reemergence of things like cholera, things that we had thought that we had done away with also, or we had managed. So these things are going to compound our health systems. These things are going to compound our ability to deal with the economy. And beyond that, and lastly, what is going to be more complex is how to deal with the economic issues of people who have lost jobs.
Right.
So if you have so many people who are hanging around and have nothing to do, then you need to be worried. And therefore the interventions, if I can speak about that, the interventions that the government needs to be putting in place, in my view, is ensuring that the stimulus packages include ensuring that you're putting money in the informal sector. So the informal sector contributes 70% of the employment. So the people that you're talking about who are walking to work and who have lost jobs, 70% of them are in the informal sector. And therefore, when you think about having to put this money into areas that are supposed to support these people to get back to work, then that makes sense. And how do you do that? You ensure that you have guarantee in terms of loans, for example. Can you have an arrangement with banks where they can give almost zero interest loans to people, and then make sure that they have a grace period up to maybe 1 year or so, and then they can start repaying. That way, you're able to, for example, reduce on having to worry about giving people money to worry about getting people back to work.
Although maybe allow me to pause you there, because that would work for somebody who possibly has, for want of a better word, guaranteed income. But now, when we're talking about the high-density area and slum areas, they, one, do not even have an income. Their income is likely to be on a daily basis. How would the bank even come in and guarantee that? Because there's no assurance that that money will come back.
Yeah, so it's about, if the person works for a Juakali workshop, then you make sure that workshop is running. So that's what you need to make sure. But this person, if they're going to wake up every morning and go and find, so that is category 2, which I was coming into.
Right.
So if they're going to work in a construction site, so how do you make sure that the people who are doing construction, for example, are back to work and are actually building houses and homes and doing all the construction that they have been doing before? So you ensure that those people who are doing those kind of projects, which are mega, are actually still doing them. So if they were affected, such that they had closed shop because they had no income, or the rental income disappeared and therefore they could not put up more houses, just making sure that they have access to cheap loans that they can actually put themselves back to work, and by extension, put someone else back to work. But there's also another category of people who, for instance, were working for social enterprises and those entities that not make much money, but ultimately also employ a large number of people. For example, we have entities within the slums that employ a lot of people, but if you look at their profit margins, they're almost non-existent. So those are the organizations that could be given access to also to some of these financing options, so that when they're back to work, they can still employ the many people that they have been employing, and therefore, by extension, make sure that the people who are in crowded places are able to walk to work and earn a living at the end of the day.
All right. There's also an area that possibly we need to focus on and just look at as we get to the tail end of this. And we remember not too long ago we had, some people being displaced from their homes in slum areas by demolition, and a number of families were displaced. So government on one hand is saying, stay home, stay safe. On the other hand, there's demolitions going on. I mean, as much as there could be reasons why that demolition was going on, the timing is obviously one that leaves one wondering, do you really want us to deal with COVID-19, or are you making it worse?
The demolitions, to say the least, were a bit unfortunate. They happened at a time when, and that's what has made some Kenyans start making comments around, is COVID really there? Because if COVID is really there, then you need to make sure that everybody is safe. And so the demolitions I do not want to speak about why, because I have no information around why exactly it had to happen at this time. But I think the unfortunate bit is that we have now pushed people to crowding even more and exposing them to possibility of even more danger of contracting COVID,
right,
which is a bit unfortunate.
Okay, and also the area that we'd look at, that maybe we also need to look at in terms of post-COVID-19 is the area of education. Those in slum areas are probably disadvantaged. Like you mentioned, they're supposed to be in public schools, but those public schools may not be there. But now that there is even no school going and, you know, the school centers have been closed, their education is definitely going to take a major hit because they're not able to access internet or online education systems that have been put in place. What is that likely to look like in years to come in terms of their education and where they will be, even given that there's this delay, and we don't even know how long it's going to take?
So for those kids in the informal assessments, what we are going to see in the next few years or in the next few months is going to be a disaster. And I say that because, number one, is that these kids are idle, and they're idle in the wrong place. So these schools were supposed to keep them busy. So what you're going to see is a lot of spike in terms of child pregnancies. You're going to see, like I said initially, issues of crime going up. We're going to see infections in terms of even HIV/AIDS, by the way, is going to go up, because people are now concentrated in one place and the kids are not going to school. So if you look at how the slum areas work, is that you will find that these kids start exposing, they get exposed to some of these things very early. And so by the age of 10, 12, 15, you have young girls who are already pregnant, which is very unfortunate. And so in the next few years, we're going to be dealing with scenarios where we are dealing with now complexities of children who have children. And the unfortunate situation of kids or young women and young men who are now HIV positive. And these are things that now will complicate and compound the problem that we need to be dealing with in the next few years. And that may be with us for another generation. Because you see, if we're going to have a drop in kids who are going to school, then it means this generation will be affected, and that will be felt in the long term. So that only does not have an effect on the social aspect of life, but also has an effect on the economic aspect of life. Because if these children will not be in school and they will not get an education, then it also means that their quality of life is likely to be lower in the future. And so these are things and realities that we need to be thinking about.
And to think about. All right, Alex Manyasi, we are out of time. Thank you very much for joining us. Your closing remarks before we wind up.
I think my closing remarks today is Menstrual Hygiene Day. And it's important to think about what this means, even as we talk about slums and other places. The menstruation, for example, out there has not stopped because of COVID. And therefore, I think as we contextualize the needs of everybody else, it's important to also think about the needs of girls and women out there who need the services and also who need the product, because ultimately the products of menstruation and the services, which include water and sanitation, are things that are key in terms of ensuring that we are not also transmitting diseases because they were unable to access some of these services.
All right. Thank you very much, Alex Manyasi, for joining us this morning. Just to weigh in and see what post-COVID-19 for slum areas and high-density areas looks like. It's now just gone 8 o'clock, and we're going to take a short break, but do stay with us. We have more news and reviews coming up on the other side of the break. This is Morning Express. We've got your morning covered.